What type of medications or treatments have people typically undergone before they become eligible for bariatric surgery?
I- There's a lot of heterogeneity in terms of what people have done prior to bariatric surgery. The vast majority of people will have likely done a multitude of lifestyle interventions, including different low calorie or restrictive dietary patterns and physical activity, too. It all depends on their underlying disease states and coverage in terms of what medications they may have been prescribed or may have access to through their insurance plans.
Mhm. So then, when this conversation about weight gain post surgery, um, what are the factors that make that more likely, and to what degree is that usually present?
So, there are a variety of things that will predispose people to regaining weight after bariatric surgery. When we lose significant amounts of weight, regardless of how we do it, there's a certain thing called metabolic adaptation that our body undergoes, where essentially we require fewer calories than we need for a given workload. So, physical activity will burn fewer calories, like our muscles become more efficient. There will be changes in kind of appetite and satiety, where we will feel hungrier when we shrink our fat cells. They change the kind of the profile of hormones that are released there in a way that can increase appetite and decrease satiety or satisfaction with food. In addition to that, there are a variety of neurohormonal changes in terms of sympathetic nervous system, parasympathetic, thyroid hormone metabolism that can really change our energy balance and a variety of factors. And so what it means is that once we're in a weight reduced state, we're then at risk for regaining weight as one of the body's protective mechanisms from not starving to death.
What are some of the factors that make a bariatric surgery kind of successful? Like, what is the care team doing to either like get ahead of this idea of like a post-surgery weight gain? What are some of the things that they look out for?
It all depends on how we define success, right? And I think it can be really short sighted when we're doing obesity care and saying that the primary outcome is just reduction in body weight and maintenance of reduced body weight. I think we need to look at it in terms of improving health long term and improving quality of life for patients as well. If we're talking about how can we help people to maintain the weight loss that they've achieved through bariatric surgery, there are a variety of things that also happen that can be specific to the surgery beyond the metabolic adaptation that we talked about. So there can be anatomical changes, for example. So if you have a sleeve gastrectomy, that can become dilated or widened so you can accommodate more food, for example. If you have a Roux-en-Y gastric bypass, there may be a dilatation of the anastomosis between the stomach and the small intestine, allowing more food to pass through. And so there are a variety of factors that kind of predispose to that may be related to surgical technique or patient education in terms of the volume of food you may eat at any one time to help to preserve those kind of anatomical things. I think the key part of this is regular follow up to see how patients are doing. The average person who comes to see us in our program for post bariatric weight regain has regained about 40% of the weight they've lost. So if you imagine if someone hypothetically lost 100 pounds with a bariatric surgery, when they come to see us, they've gained back 40 of those pounds.